My name is Kim Rhodes. I'm an assistant professor of surgery at Stanford. Well, I would say a typical day is atypical. It starts with a long drive. I actually live in Oakland. I use the time in the car, which is about an hour, to kind of transform from mom to doctor. And then I'll be in the operating room anywhere from 7:30 when it actually starts, finishing up somewhere around 2 in the afternoon. 2 days that are clinical are the main 2 days that I spend sort of focusing on patient care. The other 3 days of the week, I have the good fortune of being able to do research. I didn't want to be a surgeon as a child. In fact, at the end of high school, I had no intention of going to medical school. And in fact, in college, I had no intention of going to medical school either. I had a mentor in junior high. Her name was Alice Gross. And she told me when I was 14, she said, "You're going to Berkeley." And I said, "Okay, I'm going to Berkeley." And then once I got into Berkeley, I had a big decision, which was, am I going to do science or am I going to do something else? So I did linguistics because I was good at foreign languages and I was interested in how language shapes the way we interact with each other. But by the end of college, I started thinking, what am I going to do for a job in linguistics? I really had no idea. So I decided to take the coursework to maybe consider thinking about going to medical school. During those first few years of medical school, actually, my aunt was diagnosed with breast cancer, and it was pretty advanced. And so I made a few phone calls, and I got treated pretty poorly. She ended up dying while she was getting chemotherapy. And as I started reading about it, I found out that Black women get breast cancer less often than white women, but when they get it, they're more likely to die. And that just actually really made me so angry. One of my favorite sayings is, "Be the change you wish to see in the world." And it's a quote, I believe, from Gandhi. I do see myself as a change agent, and I feel like it's a mission of mine to see that there's justice in healthcare and to see that everyone who gets cancer gets high quality care and that their outcomes are the best they could possibly be. That, to me, that's the ultimate reward, is to have an opportunity to impact the process of how we provide care to certain populations.